Let's get Dr. Joel on here and introduce this product and talk about it.
Great. Thanks for having me on.
Morning, sir. How are you? Glad we got all the bugs worked out. Well, I got the product in the mail.
Until I heard my name in the same sentence as as Tim Waltz, but that's all right.
No, not at all. You got the real deal here. So I got the product last week. And I'm probably the best candidate for this product, 35-year veteran of the military and law enforcement. All the things they told us when we were junior soldiers, don't jump off that track, use two hands, 3 points of contact, don't jump off the ladders. Hey, climb down on the rope, just all that stuff that we didn't listen. I'm paying the price now. So an anti-inflammatory sweetener. I've used it just as the instructions said, and I've actually quit working arms in the last couple of months because I've got some really bad tennis elbow tendonitis to where, it's picking up small items like out of the bed of my truck or something is just terrible right here on my elbows. So I started taking the product when I got it, and I've quit working out, those muscle groups for now. And it seems to help a little bit. Obviously, the pain is still there, but I've seen a little bit of improvement. Maybe you want to explain the product, tell us what it's exactly supposed to do, and if I'm on the right track.
Sure. Absolutely. Well, it's an anti-inflammatory sweetener, which sounds odd because nobody else has such a thing. It's basically a supplement of the amino acid glycine, kind of cleverly disguised as a sweetener. Because glycine itself is naturally sweet, and also it's a nutrient of which you don't need milligrams or micrograms every day like vitamins. You need grams of it. It's a bulk nutrient. But it's a nutrient that most people are deficient in, and medical science has kind of passed it by and views it as non-essential. Of course, the word non-essential is toxic, as we all found out during the COVID lockdowns. But it is actually essential for the normal functioning of the immune system. So inflammation, which everybody now knows is the root cause of most of the diseases that make people sick and die these days, including diabetes and cancer and heart disease and a host of others. It all goes back to inflammation. And scientists and medical science just can't seem to understand why inflammation goes out of control. It's a natural function of the immune system. It's really the first responders of the immune system. And the reason why they don't understand why it's out of control, this is what I discovered about 13 years ago, or 14 years ago now, is that inflammation, contrary to what has been thought and what is still thought most of the time, is that inflammation is a natural response to injury. You get a sprained ankle, it gets inflamed. You get a sunburn, it gets inflamed. You get all of these blunt injuries, inflammation naturally follows as a natural first result, which is then followed by the healing response. Well, it's an interesting question to entertain as to why does your body do exactly the wrong thing whenever you get injured? So you have to put ice on it in order to suppress inflammation. The reason is medical science does not understand inflammation. Inflammation, when it is in response to an injury, not an infection, just causes damage to normal tissue. The purpose of inflammation is to stop an infection, to keep those bacteria or other nasty microbes from killing you to kill them before they kill you. But it has no reason to happen when there's not an infection. So why does it happen? It happens because most people are deficient in the amino acid glycine, because it turns out glycine is the body's main own regulator of inflammation. So glycine, and in this product, sweetamine, does not fight inflammation. It just turns it off the way your body does. And one of the key things you can tell about how it's working is that if the pain you're suffering is pain of inflammation, it's going to hurt whether you're moving the muscles of the joints around that are affected by it or not. Because if you have some injury, it may cause pain when you're moving stuff around just because the injury is exacerbated, or it hasn't healed right, or it hasn't healed completely. And there's a lot of scar tissue which can cause tearing and pain and so on. But inflammation hurts anyway, whether you're moving it or not. And so the first thing that most people realize, did something just pop up on my screen here? I got it on my
I don't see anything on this end, sir. You're
Oh,
good.
okay.
You
I got a
continue
little
on. You got me hooked. Now you
If you
can't
don't
stop.
see it, that's fine. I don't care. In any case, that's how you know that it's working. That things which hurt all the time stop hurting when you're not using them. And usually, one packet a day, which has 8 grams of glycine in it, is enough for most people. You can take 2. Sometimes people need 2 packets a day, and sometimes it takes a while. But usually, you can feel the difference in 2 or 3 days. And it's a perfectly natural product, and it's formulated to be about as sweet as maybe 2 teaspoons of sugar. You use it like a normal sweetener. But it's not only great for diabetics, for example, but glycine can actually reverse diabetes. It's been shown in clinical trial. I'm not going to make claims for this product just to stay under the radar of the FDA and making medical claims. Pain is not a medical condition. Inflammation is not a disease. So I can talk about how it stops inflammation the natural way. The best way to explain it, I think, especially to someone who is military or first responder type occupation, is that since the cells in the immune system that cause inflammation, they're called macrophages. Since they're the first responders, they're a great example. They act just like the first responders do out there in society. So if there's an accident on the highway, right, and you get a pile up on the highway, who comes first? The first responders. The state troopers, the cops come, right? They come, they take accident reports, they divert the flow of traffic, they call the ambulances, they call the tow trucks, they get everything then cleaned up, they get the mess cleaned up, they restore traffic flow back to normal, and then they go back to their base. Now, all the while, they're armed. They've got loaded weapons in their holsters, but they wouldn't dream of using them unless there are bad actors present. Your immune system works in exactly the same way. It is those same very cells that cause inflammation that most of the time are there to just clean up the mess, to take care of the site of injury, to clean up the dead and dying cells and cell debris, and then go back to their base. But when they're deficient in glycine, they get activated into a state where they just start shooting the place up. So imagine if every time there was an accident on the highway, the cops came and started shooting the place up. Well, actually, that's what's going on right inside the body of most people. So no wonder by the time you're 40, you're starting to feel the effects of so-called aging. They even call it sometimes inflammaging, because you start getting all kinds of, arthritis and, painful and swollen joints, diabetes, cancer. All these things are happening more frequently and sooner in life than they ever used to. So here's a question. Why is glycine deficiency so widespread, and why is it worse than it ever was? And the reason is that we eat more and more and more muscle meats, meat, fish, and poultry. And what do we usually do? We eat, a bacon and eggs for breakfast and a tuna fish sandwich for lunch and a steak or chicken dinner. You got a lot of that, a lot of meat, muscle meat consumption. But the bones, instead of what our grandparents used to do, most likely, wherever we are from in the world, they used to throw the bones in the soup and we throw them in the trash. Well, it turns out that glycine is mostly in the collagen. That's why collagen or bone broth or gelatin are all good supplements. These supplements are about 25% glycine by weight in the protein. This product, Sweetamine, is the free amino acid. It's not in protein. It's just the amino acid itself, so it doesn't need any digestion. It's absorbed right away. And that provides what we now kind of throw away when we eat meat, fish, and poultry. But why is it worse? Because we're eating more meat, fish, and poultry. And that has to do with the particulars of the amino acids. Meat, fish, and poultry muscle meats are very rich in another amino acid called methionine, which is essential. Well, so we all learned in biochemistry and in medical school how, methionine is so important. It's essential. The body recycles it and regenerates it, and how important it is. But in fact, because your body is so good at conserving it and regenerating it and recycling it, we don't need very much methionine. So after you've eaten that cheeseburger for the next hour, your liver, instead of recycling it and saving it and regenerating it, is really getting rid of most of it. And unfortunately, the biochemistry is such that in order to get rid of the excess amino acid methionine, it has to use up 2 molecules of glycine for every molecule of methionine that's gotten rid of. So what we're doing in the modern age, in the modern technological society that we live in, we eat a lot more meat, a lot more methionine, and yet the part of the meat, fish, and poultry, the bones and connective tissue that naturally balances that out by helping our bodies to get rid of it, we're throwing that away. So we become exceedingly glycine deficient. And really, most of these diseases that make people sick and die these days, I would classify as glycine deficiency diseases. And I don't worry about any of them myself. And, and I feel great. It doesn't mean you won't age. It doesn't mean you'll live forever. But, it used to be that people would, sail on into their 90s and gradually slow down until their life was done without spending half of their life, decades, with all kinds of prostheses, artificial hips and shoulders and all kinds of medications for all these conditions, all these, injectables and whatnot to stave off diabetes and so on and so forth. And we usually end up still dying of cancer or heart disease, and the average life expectancy is only in the 70s, not in the 90s where it really should be, if we didn't have all of that unnecessary, inappropriate inflammation. And 1 packet a day is all you need to get rid of it. And we sell Sweetamine, in boxes of 30, so you get a month's supply. But we also have a starter pack that just has 12 packets in it. We call it a 12-day challenge because, as I said, most people feel the results within 2 or 3 days. So it gives you a chance to experiment with it. In a few days, you start feeling the results. You take it for a few more days. You start feeling better. You wonder if that's what's really doing it. So you stop it for a couple of days, and then the pain starts coming back. This is the typical scenario. So you have time to experiment with it. And if for any reason you don't like it, you don't like the taste, you don't like anything about it, you just decide you want your money back, just let us know. It's sold completely risk-free. And your listeners, if they enter the promo code that you'll give them is, gives them a $5 discount. So for under $15, you can get a 12-day challenge and try it out. And so there really is no risk in any way. And we really just want people to try it. My background is as a scientist and a professor. For 34 years, I taught biology and endocrinology at the City University of New York. I was a bench scientist, a research biochemist for many years. When I came upon this, I just wanted to be able to share it with the world instead of just arguing with academics for the next few decades until it became accepted, because that way nobody would get the benefit of it. Now you can. And as I said, it's risk-free, and if you like it, it's not expensive. It's a great way to, enter, especially into your later years. Instead of waking up every morning and feeling a little bit worse, you wake up every morning, feel a little bit better as those things that have plagued you with inflammation go away. So the inflammation goes away right away. The damage that inflammation has done to various muscles and tissues and joints and so on will gradually go away with time, as long as you keep up this.
Let me jump in here, Doc, with a couple of questions. You've thrown a ton of information out there. I actually had questions written down, and I think you've answered almost every one. But I'll just use myself for example. 58 years old, active my entire life. 35 years of beating up my body all over the world. I still beat up my body pretty good now at 58. When would be the best time to take this? Is this a morning thing, a night thing, or after a meal?
It's anytime. Good question. It's anytime you like, and you can take it in, coffee or tea, sprinkle it on your oatmeal. However, you can even put it in fruit juice if you want. But it doesn't matter what time of day. However, because glycine also has some calming effects on the central nervous system. There are actually companies that sell glycine supplements to help you sleep. It's not a drug, but it helps. It's a kind of nutrient that will calm your brain down. And so we didn't stage prefer to take it at night. Sorry,
we didn't stage this because that comes to my next question. Of course, I go to the VA health system, and I have some issues sleeping, like everybody else does, and I take an extra vitamin D because I'm deficient, and a high dose magnesium to help me sleep. That was my next question. So if this reduces the inflammation, could I double this with my magnesium and possibly sleep a little better, because that seems to be the time after 3 back surgeries. Once I lay down in bed at night, finding that comfortable position without cramps or my back feeling stiff. I've been taking this in the morning. Maybe I should move this to the evening time based on what you're telling me.
Maybe a good idea. May I ask what kind of magnesium supplement you're taking?
I have no idea. Whatever the VA sends me is what I take.
Oh, okay.
It's a high dose. I don't remember.
One of the popular ones.
Yeah, well, it comes in the VA bottle. It is a natural magnesium supplement due to my deficient levels.
The reason I ask is very simple. One of the most popular ones and natural organic ones, that forms of magnesium supplementation people take, is called magnesium glycinate. That happens to be 85% glycine.
You know what? So, I think that's exactly what it is. Thinking about the bottle now, I wish I would have brought it in here. I think that's actually what it is.
Right, so, maybe. So you may well be taking
no risk of overdose or damaging any internal organs, nothing like that. It's an amino acid that we should have in our body that we're already deficient in, correct?
Right, and it's not I'm not saying that every amino acid you can take with abandon. Remember when I talked about methionine, that you really only
I'm tracking
need.
That's why I'm bringing that up. This is one that you either use or lose, correct?
Right. Yeah, that's right. This one, because it goes through you very quickly. It's a very small water-soluble molecule. It goes through you very quickly, so you really need to replenish it every day, and that's why you can generally feel the benefits within a couple of days.
Well, it's been a week, and I don't know. Like I said, I'm giving it a fair assessment. I don't know if it's been the not training those muscle groups and taking some of the pressure off of the tendons, or if it's been this, but I have noticed a difference probably in the last 3 days or so. It hasn't been as bad, and just simple stuff like grabbing the garbage out of the back of the truck and putting it in the dumpster has been a little bit more comfortable. So it could be the product.
That's why.
A ton of information. You gave us a ton of information. We put the phone number out. It's 845-231-4840. Give them a call, order this product, and try it. Like I said, I'll never put anything on this program that I don't believe in. So right now we're still in the trial phase, and so far it's working. I'm going to adjust my dosage a little bit and move it to the nighttime, and we'll leave it there. And I'll let you know. I'll send you an email or a text and let you know how it's doing.
Great.
I appreciate all the information. You threw a ton at us, and great having you on. And we'll have you back again in a couple weeks or so, and we'll do a follow up and go from there.
Okay. Thanks very much.
All right. Great. Thank you very much, sir.
Have a great day.
You too, sir. Bye-bye.